Thank you, Presiding Officer. I'm pleased to speak in this afternoon's debate, and I'd like to congratulate my colleague Stuart McMillan for securing this afternoon. Stuart covered the facts and stats really well regarding eye health conditions during this week, as it's highlighted as National Eye Health Week. And I agree with what Mr McMillan has explained. I'd like to pick up on the point, though, related about obtaining an eye exam. I noted the wording in Stuart McMillan's motion, which calls for the public to get their eyes tested on a regular basis by utilising the free eye examination. As a nurse, I've been able to use my experience to help inform me for this debate. And a vision test during a visit to the optometrist isn't just a way to check whether one's eyesight needs help with corrective prescription. The main purpose of getting an eye exam is to detect and diagnose vision problems. However, an eye exam, as has been described, can also help you detect signs or other health issues which may affect other parts of the body. Last year, when I spoke in this Eye Health Week debate, the focus was on diabetes and retinopathy. And according to Diabetes UK, there are around 750,000 people across the UK who have undiagnosed diabetes. And following a discussion with an ophthalmic nurse specialist this week, who happens to be my wee sister Buffy, she conveyed that many diagnoses of type 2 are often made at the time that an eye examination is performed, when people describe their symptoms and when retinal photographs are taken. Many people do dismiss their symptoms of gradual visual impairment as growing old, or even put it down to tiredness. But the high blood glucose levels associated with the poor controlled type 2 diabetes can mean that the tiny wee blood vessels in the eye, which can be damaged by high levels of blood glucose, can lead to the diabetic eye disease retinopathy. If type 2 diabetes is picked up, diagnosed and treated early, visual impairment complications can be detected and treated, and protection of a person's sight can then be achieved. High blood pressure has been mentioned, and it's a disease with far-reaching complications, not just for the eyes, but because the blood flow affects every part of the body. But fortunately, high blood pressure is another example of a health condition that may be detected during an eye examination. One disease that hasn't been mentioned is rheumatoid arthritis, and I was actually quite surprised about this. Most people don't know, however, that rheumatoid arthritis can also affect the eyes as well as the joints, and it's an inflammatory process. But if your rheumatoid arthritis has affected your eyes, then you may have dry eyes, eye pain and other vision problems. The news is that early treatment can prevent permanent vision damage. Presiding Officer, I'd like to thank the Royal Blind for their briefing ahead of this members' debate, and highlighting the importance of vision testing, as the Royal Blind have said, seeks to get the message out that most people should have a sight test once every 2 years and every year for many other identified groups. The symptoms that an eye professional may detect includes spots in the retina, bleeding in the back of the eye and constricted vessels, among others. Again, having one or more of these symptoms doesn't mean that you might have high blood pressure, but it means that you may need further consultation to determine what is causing the symptoms. Presiding Officer, one of the other issues is that multiple sclerosis in young people, my sister was telling me, was that young 30-year-old women showed up in her clinic one day with a sudden visual impairment, and this led to a diagnosis of multiple sclerosis. So I think it is really important that we raise awareness and remind people to schedule an eye examination, follow your healthcare professionals and doctors' advice and recommendations on a suitable follow-up test and treatment. So I echo Stuart McMillan's call for the government to support and promote a refreshed national eye check campaign, and that maybe following the eye exam, glasses might not be the only thing required, but other medical issues can be addressed, diagnosed and treated ahead of any complications developing. Thank you.